standardized method for measuring the visual acuity in terms of the focus curve, where we see right here the typical focus curve that we can see in the papers. On the top, we can see two different trifocal lengths. We are not going to say the name of both, but we can see that that profile. And down, we can see also another defocus curve. This defocus curve is one of the lengths that we have on the top. It's absolutely different. It's absolutely different because we have different methods in the units, and also we have the inverse images. So we need to convert the defocus curve down in terms of being the most similar, standardized to the another one. And we can see these images that we don't have exactly the same defocus curve in different conditions. But you can see, you can think, well, this defocus curve, probably the blue defocus curve of the right is the same to the blue of the left. Not at all. It's the red one. So, as conclusion, we can see the reason, because we cannot put all our faith in the focus group that we had published. But what is the reason? The reason is because the visual acuity theory depends on the optotype usage. Also, the experiment BS have a great influence. It's very big influence that depended on the explorer. Also, the time spent, you can push your patient in order to identify the optotypes. And we can see that they have published a paper talking about the difference of two lines of visual acuity difference in the same subject. So, absolutely, we are going to need a skill, an application to automatize the method, to not depend to the experimenter, and having a standardization and automation for all of us in the whole of our clinics. But the other question is complete the visual acuity for us? We can see different type of lens, different type of multifocal lens with different interpretation of light in terms of percentage and another kind of situation. And we have that information in the optic laboratory. It's talking about the MTF in the optic laboratory, and we can see that the focal curves, but in experimental optical band. So, could we change that optical laboratory result outcomes to the practical, to our practical? How can we measure it? Well, we can see that the MTA puts you a pattern of cycle pass to the objective, and we can see an images in the final optic system. If we put in the middle the intercalaar lens, we can see the same. We can see the result of passing that pattern for the lens. After that, we can measure the modulation. It's very simple. And we would like to see this situation. As our talk in the MTF, we are going to have better quality of vision in our lens. But measuring in terms of optical quality versus visual performance, we can see how to transform in terms of contrast sensitivity in our normal practices. We can see this. We are right now talking about contrast sensitivity. We are right now measuring only in the horizontal line with a lot of contrast sensitivity. But we need also to know the performance of the multifocal lens in low condition of contrast. So with those two parameters, we are going to have exactly what is the performance of our multifocal lens in our patient. We have defined that value of 0.3 logMAR in order to having the more standardized measuring of the contrast sensitivity in the focus curve, and we can see the optical quality of multifocal lens in order to see it like exactly what is the performance of our multifocal lens in our patient in terms of contrast sensitivity in low condition or poor condition of quality of vision. So we are going to have an automatized method which does not depend on the experimenter. It's very important to have a very standardized process and also based on visual acuity or even in contrast sensitivity. In conclusion, the advantages of measuring the focus curve with this application will be free, distributed by the Apple Store, also I think with the skill of Faco Engine, and the standardization between surgeon or our clinic, and probably connected to an online database to use that big data in order to having conclusion for our daily practices, and also the advantages of measuring the contrast sensitivity, the focus group, is the idea of that the sensitivity for detecting such a change in the optic quality is increased. Any difference, any little difference, we are going to identify quickly. We are not going to have now those images near the contrast sensitivity is 32, more levels than ever, 13 levels for visual acuity, 22 levels for contrast sensitivity, and also the uniformity with the modulation measuring at the lab. Thank you very much.